So the role of RN, I said, first of all, the assessment, the client assessment, and also the determine the plan of care. This is the role of RN, and care for the most critical or unstable client. For example, the post-operative client. So after the surgical operation, right, who will take care of them? RN has to take, and the client with the change in the condition who need the assessment. So if the patient is condition is changed, support the patient is conscious, suddenly patient go unconscious, means their condition is going to change. That times we need assessment again. The RN should do this. During the admission, who take care of them or get them the admission? RN. During the discharge, who write the note or who educate the patient before leave the hospital? RN, right? Even when patient need to transfer, like your patient in medicine department, and suddenly patient need the X-ray or MRI. So that times patient need to go to the radiology department. So RN should transfer them. RN should transfer them here, and also assessment the available staff and their job description. So I said the team leader should be RN. Team leader can decide which LPN take care of which patient. What is the CNA responsibilities, right? So assess the available staff and their job description, because the CNA or LPN is not same thing, right? It's totally different job for. So but RN should assign you. Support a LPN is very skilled, already know what are the how to manage the patient, but a new LPN supposed to go for the most stable patient, take care of, perform the most complex procedure. For example, the starting the IV. So when patient need to start the IV saline or blood transfusion, definitely this type of patient has to take care of the RN patient, right? If patient need any kind of IV or saline solution or blood transfusion, always RN should do it, right? RN should take care of them. So also I said the IV or interpret the EKG. So EKG. So what are the diagnosis of EKG? Is it arrhythmia or tachycardia or MI or atrial fibrillation or atrial fluttering? This should be diagnosed or interpreted by RN and after till to the doctor, right? Also co-related to the lab value. So when a lab value come, right, findings of the laboratory values, you have to find out, is it any problem, abnormal values? Then you has to inform patient, you has to inform the doctor, right? Correlate to the lab values. It is you responsible, RN responsibilities. So if you do not know what are the normal lab values, it would be difficult for you, right, for the job. Also the collaborate with the other department and discipline. So imagine a patient is diagnosed by carcinoma, and patient is the last stage of his life. So if a patient is waiting to die within 6 months, that times hospital authorities tell to transfer from hospital to hospice center. So RN responsibility to coordinate with hospital with the hospice center. RN should organize everything. They talk over the phone, communicate with them, then patient should be transferred right from hospital to hospital. So that it is the part of the collaborate with the other department and discipline, and also the direct or supervision for the LPN, right? So LPN always work under supervision of RN, right? Also, unlicensed assist personnel is called UAP or CNA, Certified Nursing Assistant. So this also assigned by RN, right? Also act as a client advocate. So if any patient need any kind of advocacy, so RN supposed to do this here. So what are the roles of LPN? Here, LPN. So LPN care for the client in the stable condition. If a patient is absolutely stable, means the vital sign is normal range, not fluctuate. Patient is not come after any surgical operation, right? It's called stable patient. So also LPN always work under supervision of RN, right, or other healthcare provider, perform the basic therapeutics, preventive or rehab procedure. So always keep in mind LPN most important function is the medication administration. So give the medication, check the vital sign. This is the function by LPN. So perform some basic technique, right? Perform like sterile dressing change, and also the urethral catheter and NG tube insertion applied of restraint, or assess the RN with unstable or complex clients. So they can assist them. They can assist them, I said. So the role of LPN, I said LPN can take care of the stable patient, and also the LPN can do some um, basic therapeutic or preventive or rehab procedure like the dressing change, urethral catheter, and apply the restraint. So here the sterile procedure, the LPN can do the participate or take care of the sterile procedure in case of stable patient. But here the IV, okay, so IV, the RN are not allowed to start the IV therapies, right? Application the restraint. So application the restraint, only application can do the LPN, but take the order from the doctor, decide the site, all of the things should be RN should do the take care of the restrained patient. Also, every 15 minutes, you have to check the neurovascular status, but RN is supposed to do this, not LPN. And also, the here's the nasogastric tube, NG tube, nasogastric tube placement. All right. If the patient is stable, the LPN can do this. But if the patient is unstable or before or after surgical operation, RN should do this one, nasogastric tube placement. And here also the urethral catheter, man or female, the LPN can do this procedure. And also here showing same the urethral catheter. This is the catheter passing through the urethra. And here the chemotherapy. Chemotherapy are not allow LPN. Chemotherapy always do the RN, right? Always do the RN. Chemotherapy central line, always RN. Never ever allow the LPN. Central line, others called the PICA line. PICA line. Blood transfusion. Always do the RN. Also keep in mind, when a patient is ready to blood transfuse, the 2RN must check everything, vital sign, and check the blood, the information on the blood bag. And also keep in mind, when or after that started the blood transfusion, the RN supposed to be with the patient first 15 minutes to check any kind of blood transfusion reaction. Just check for this. So this is the rules for LPN and RN. And I said last one from here, this is called the rule of CNA. What CNA is supposed to do? CNA do some non-skill care, some provide the routine test, non-skill care, such as bed making, also the patient bath, right? Bed making, patient bath, or routine vital sign check. So it is also the rule of CNA or UAP. Also, CNA can assist the patient, assist the RN. They work under the supervision of RN. So enema, also the oropharyngeal suctioning care, the CNA can do this. And here I said, let me check something.